Okay, so hi guys. So for today, we will be having a discussion regarding the HIV law. But prior to that, we will be discussing facts about HIV, its etiology, its origin, mode of transmission, as well as some myths associated with HIV. Okay, so for the learning objectives, first we will discuss the morphological characteristics of HIV. We define the etiology and pathogenesis. We identify the stages wherein there are three. Okay, we explain the modes of transmission, prevention, as well as treatment, and describe the roles and functions of PNAC and other agencies, clarify the role of schools and other institutions in campaigning for AIDS prevention and treatment, and enumerate the provisions mandated by the RA 8504. Okay, so in our country, um, HIV cases have risen abruptly. Actually, there was a time wherein we are the number one in Southeast Asia when it comes to the highest number, okay, of HIV related to population. Okay, yung pinakamataas na itatala tayo, may pinakamabilis na pagtaas ng kaso ng HIV. Okay, so in spite of this preventive measure, the Philippines is considered to be one of the 7 countries globally where AIDS cases have spiked to 25% from the year 2001 to 2009. So actually, the cases of HIV is alarming. However, because of the pandemic, okay, so nawawala na yung mga important problems of the country kasi the media and as well as the government is only focusing on the pandemic. Okay, so even if they are not focusing much on it, but when we base it with the news, okay, what we only hear most of the times about COVID cases. Okay, so let's discuss the overview. So HIV, the transmission and important. So we'll discuss for each HIV, its transmission and important virulence factors, and of course the RA 8504, which was signed to help protect, screen, and provide confidentiality to persons living with HIV or AIDS. Okay, so the origin of HIV, as per some discussion from books, it actually originated from chimpanzee. Okay? So, sa chimpanzee daw siya nanggaling. So, when we relate it to our pandemic, diba, there was a theory that coronavirus actually came from bats. Okay? So, bats naman daw sa COVID. But for HIV, it came from chimpanzee. So, the chimpanzee version of the virus, called the simian immunodeficiency virus or SIV, was probably passed to humans when humans hunted these chimpanzees for meat and came in contact with their infected blood. So studies show that HIV may have jumped from chimpanzees to humans as far back as late 1800s. So over decades, HIV slowly spread across Africa and later into other parts of the world. So we know that the virus has existed in the US since at least the mid or late 1970s. So for the key concepts, HIV virus, that is single-stranded envelope RNA virus. So this one you will have a further discussion later on in Micro 2. So Micro 2 is about viruses as well as um, fungi. So the classification of HIV, it is a single-stranded because there are viruses which are double-stranded. Okay? And it is envelope. Meron kasi siyang envelope which protects the virus. And this is an RNA virus because there are also DNA viruses. So it belongs to the family of retroviruses. It's a fragile virus because it cannot live on its own. Okay, it must stay or live inside the host cell for it to survive. So AIDS, which lowers the immune response of the body to ward off diseases. So HIV, guys, it refers to the causative agent of AIDS. When we say the acquired immunodeficiency syndrome, we are referring already to the infection that is caused by HIV. Okay, so this is actually the chronic or the last stage of infection. So this is an obligate, which should be obligate intracellular parasite. Okay, so what do you mean by this one, obligate intracellular parasite? It is it is acting like a parasite, okay, because it robs the host cell, okay, from the necessary materials like the DNA or RNA material for it to replicate. Okay, so ginagamit niya yung mga nasa loob ng cell for it to survive and to replicate. Okay, so it cannot live outside the cell. That's why that is an obligate intracellular parasite that infects a specific type of cell called the CD4 cell, commonly known as T helper cell. Because yes, T helper cell is under um, white blood cell. So we have the CD4 and the CD8. So the main target of HIV is the CD4 T helper cell. Okay, so CD4 T helper cell. When we say CD4, we are referring to the cluster of differentiation. Okay, so that is present in the T helper cell. So we have here the structure of HIV virus adapted. Okay, so this is a schematic and somewhat simplified for clarity. For example, the structure of the envelope. So we have here the envelope. Okay, this one. That's the envelope, which is the glycoproteins GP120 and GP41 are actually trimers in reality, so not the monomers. So which is not shown here. So this is the structure, okay, or schematic diagram of what HIV looks like. Okay. Okay, so there are three enzymes that infect healthy cells of the body. Okay, so these are the very important enzymes which contributes, okay, to the pathogenesis of HIV. Okay, I'm sorry for the background noise. So we have the reverse transcriptase. So the reverse transcriptase, it is used by the virus to transcribe from DNA to RNA. So the virus is an RNA, but it can transcribe itself to become DNA by using the enzyme reverse transcriptase. On the other hand, the integrase, it is also an enzyme, okay, that the virus utilizes to penetrate target cells in the body. Okay? For penetration of target cells para makapasok siya sa kanyang target cells, which are the CD4 T helper cells. Okay? And the third one, that is the protease, which is responsible for the maturation of the virus inside the target cell, responsible for the maturation of virus. Maturation of virus inside the target cell. Another two important glycoproteins, the GP120 and the GP41, they are located on the surface of the viral wall, and they are responsible for point attachment to target cells. So this one, GP41 and GP120, okay, they serve as the point of attachment to CD4 T helper cells. Okay, so once the virus infects an individual, it will undergo a period of latency and may be completely undetectable by screening methods for 6 months to even several years. So actually, this one hinders early detection of HIV infection. Why? Because even if you are already infected with HIV, if clinically the level is not yet detectable, then your HIV or the HIV result of an individual will be negative. Okay? Kasi masyado pang mababa yung viral load para mag-positive yung screening method. Okay? So, that's why it's when you are doing something with a stranger, like, of course, sexual intercourse, it is always a must to protect yourself. Okay? Kasi, malay mo na-infect ka ng HIV. Okay? So, past 3 months, wala ka pang nararamdaman. But, several years later or several months later, you'll develop some symptoms. Okay? So, yung mga initial symptoms for the early stage, um, it's not specific naman to HIV. Okay? So, hindi mo agad iisipin na may HIV ka. Okay? So, eto, even if a person is infected, if the viral load is not yet high, they would be negative in the HIV screening test. Okay? Kaso nakaka-infect na sila. Okay, so what are the transmission of HIV? So, viral load and body secretions are considered high and are transmitted to another person through direct contact. So, of course, number one there, that is through sexual contact. Okay? So, sexual contact, this is the most common way of transmitting the virus through sexual contact. Okay? So, the viral load in body secretions such as in semen, vaginal fluid, blood, and breast milk are considered high and are transmitted to another person. Okay? Through direct contact, even sharing of needles, or even mother to fetus, mother to newborn or fetus transmission. Okay, so the virus, guys, is also present in other secretion, even in tears, in sweat, in feces, and even in urine. However, the amount of virus is not enough to cause an infection. Okay, meron mang virus dun sa tears mo, sa tae, feces, diba? Or even in sweat. The viral load is not high to infect an individual. Okay? So, the most common transmission of HIV is, of course, through sexual contact. That's why I always practice safe sex. Okay? Another means of transmitting HIV, that is, of course, sharing of needles by drug addicts. Okay? So, why, guys? Why does this happen? Because, of course, um, if not all, they are not knowledgeable about STDs, okay, like HIV, and they use uh, only several or few, okay, or one needle. So, they share among themselves. So, if yung isa infected, tas ginamit naman ng isa yung needle, okay, or the syringe, so pwede din siyang infect. Another way is blood transfusion of infected blood products. Okay, but guys, take note, all blood products are tested for HIV. Okay? So, natetest yun sa HIV. However, yun nga, there are cases wherein the viral load is so little that it would result to a negative result in the HIV screening test. Okay? So, negative siya pero meron pala yung virus. So, that is possible. Another is accidental skin punctures, which is associated in the workplace area. Okay? Sa mga healthcare worker, if they use the needle to a patient who is positive with HIV and they accidentally prick themselves. Okay, so nangyayari naman yun. Though this is very rare as compared to the transmission related to sexual contact. Okay, so how can someone get HIV? Okay, so guys, take note, anal sex. Okay, so that is the riskiest type of sex for getting or transmitting HIV. Okay, so an individual can get HIV if he or she have anal sex with someone who has HIV without using protection. That's why a good way to prevent HIV transmission is the use of condoms, of course. That is to protect the persons involved in the sexual intercourse to be infected if one of them is positive for HIV. Okay? So, anal sex, again, is the riskiest type of sex for getting or acquiring HIV. So, bottom is riskier for getting HIV than being top. So, what does that mean, guys? So, being the receptive partner, siya yung nasa baba, is riskier for getting HIV than being the insertive partner. Okay? Mas madali daw, mas riskier para sa napapasukan, okay, na magkaroon siya ng HIV compared dun sa insertive partner. Okay? Dun sa pumapasok. Okay? Sa kung sino yung nagpapasok ng ano. So, alam ko naman gets yun na yun. So, the bottom's risk of getting HIV is very high because the rectum's lining is thin and may allow HIV to enter the body during anal sex. So, the top is also at risk because HIV can enter the body through the opening of the tip of the penis, the foreskin, if the penis isn't circumcised, or if there are small cuts, scratches, or open sores anywhere on the penis. So, can a person get HIV from vaginal sex? So, when we compare the risk of getting HIV with having vaginal sex as compared to anal sex, vaginal sex is less risky as compared to anal sex. Okay, so however, just like for anal sex, both partner can get HIV through the mucous membranes that line the vagina and cervix. So the men get HIV through the opening at the tip of the penis or urethra, the foreskin, if the penis isn't circumcised, or if there are small cuts, scratches, or open sores anywhere on the penis. So actually, any type of sexual intercourse, a person can be infected if he or she does not use any protection like condom. Okay, so even in oral sex, an individual can still be infected with oral sex. So we will have a discussion on that in the later part. So, can HIV be transmitted from a mother to her baby? Yes. Okay, so during pregnancy, birth, or breastfeeding, the infant or the fetus can get or can be infected with HIV from the mother. So, this is called the perinatal transmission or mother-to-child transmission. So, mother-to-child transmission is the most common way that children get HIV. Okay? So, if a mother with HIV takes HIV medicine daily as prescribed throughout pregnancy and childbirth and gives HIV medicine to her baby for 4 to 6 weeks after giving birth, the risk of transmitting HIV to the baby can be less than 1%. That's why, um, even if the mother is HIV positive, as long as she goes through treatment regimen, okay? So there is a higher chance, there is a 99% chance that the baby, okay, or her newborn will not be infected with HIV, okay? Because the viral load is so low, okay, that it will not infect the baby. Okay, so hindi tama yung nagiging notion that if a mother is HIV positive, then the baby or the newborn will also be HIV positive. Hindi po sa lahat ng pagkakataon. As long as the mother undergoes a treatment program. Okay? So, can a person get HIV from shared needles, syringe, or other drug injection equipment? Yes. Okay, so this activity is high risk to be infected with HIV. So, a person are at high risk for getting HIV if they share needles, syringes, or other drug injection equipment. Okay, who has HIV. So, to prevent this one, never share needles or other equipment to inject drug, hormones, steroids, or silicone. So, the used needles, syringes, and other injection equipment may have someone else's blood on them and can carry the HIV virus that will be transmitted to the person wherein the syringe or the needle is used. People who inject drugs are also at risk for getting HIV as well as other sexually transmitted diseases just like hepatitis, okay? So, because they may engage in risky sexual behaviors like having sex without protection. Kasi nga naka-high na sila. Okay? So, kapag naka-high na, pwede na sila makipag-sex kahit sino-sino. Because they're out of their mind. Okay? So, a person, in that case, a person can also be infected with hepatitis B and C. Or B or C and other infections if they share needles, syringe, or other injection equipment. Because HIV and hepatitis, these are blood transmissible diseases. Okay, so if a person, if an infected person gets in contact, if his or her blood, okay, is contaminated um, with a blood from an HIV positive or hepatitis positive individual, there is a high chance that he or she may also be infected with the said virus. Okay, so what are some rare ways that HIV has been transmitted? So, oral sex. Pwedeng matransmit ang HIV through oral sex. Okay, um, so it involves putting the mouth on the penis, so that is fellatio. Okay? So, kapag nilagay yung mouth dun sa penis ng isang individual, we term that as the fellatio. Okay? Or if yung mouth naman, sa vagina nilagay, that is cunnilingus. Or kapag anus naman, we term that as reaming. Okay? So, reaming or that is also known as the anilingus. Okay? So, in Tagalog, kapag kinain ang penis ng lalaki, we term that as fellatio. Pag kinain yung pepe ng babae, that is cunnilingus. Or kapag yung anus naman or the anal area ang kinain, that is streaming or anilingus. So, those oral sex, okay, may also put risk to an individual to be infected with HIV. Okay, so factors that may affect this risk include ejaculation. Okay, kasi diba, there are individuals wherein they ejaculate on the mouth of the other individual. Okay, so if that person has high viral load, pwedeng, diba, nilulunok pa yun minsan. Kung merong sugat-sugat yung mouth ng isang individual wherein the semen was ejaculated in his or her mouth, pwedeng mag-contact, pwedeng pumasok through the cut, source of the mouth, yung semen that is contaminated or which has HIV, and pwedeng ma-infect yung individual. Okay? So, in the mouth with oral ulcers, bleeding gums, or genital sores, in the presence of other sexually transmitted diseases. So, an individual can get STDs from oral sex. Yes, guys. Hindi lang through anal or vaginal sex. Pwede din makuha ang HIV through oral sex. Okay? So, if you get pieces in your mouth during anilingus, again, yan yung kapag yung mouth area nilalagay or kinakain yung anal area ng partner. Okay? You can get hepatitis A and B. Okay? Not only those, but also Giardia and bacteria like Shigella, Salmonella, which causes diarrhea, diba? Campylobacter as well as E. coli. Okay? So, but for Shigella and Salmonella, not only diarrhea, but like for example, Salmonella typhi may cause or may lead to typhoid fever. Okay? So, guys, be careful on how you perform sexual intercourse, lalo na kapag mga oral sex. I know you're not young already for this topic, okay? So, always protect yourself. If you do this, I hope hindi pa naman with your age, you're still too young. Okay? But in case, if you do it with protection. Dapat protektado ka. Okay? So, in the workplace, the most likely cause is being stuck with a contaminated needle or another sharp object. So, careful practice of standard precautions protects patients and healthcare personnel from possible occupational HIV transmission. So this one, HIV that is contaminated sa workplace, it usually involves healthcare workers through accidental needle prick, okay? So, pre-chewed food, okay? So, eto medyo bago din sa akin to. So, actually, this information of the possible ways of transmitting HIV, I got this from CDC, Center for Disease and Control. Okay, so the only known causes are among infants. Contamination occurs when blood from a caregiver's mouth mixes with food that is pre-chewed before feeding to an infant. So you can get HIV from consuming food handled by someone with HIV. So kapag ninuya yun, okay, ng isang caregiver, okay, yung food bago niya ibigay sa infant, pwedeng ma-infect yung infant. Okay? So, pwede yun. Pero kapag yung cook nyo, yung chef nyo, is HIV positive and tagaluto lang naman siya. Okay? So, hindi ka may infect ng HIV. So, even with kissing, okay, hindi ka may infect ng kissing as long as that is a close kiss. Okay, yung mga beso-beso. Okay? Pero kapag deep kissing, possible na magka-infect ka or ma-infect ka through deep kissing if there are open sores, okay, or mga cuts sa lips or sa mouth area. Okay? So, biting. Each of the very small number of documented cases has involved severe trauma with extensive tissue damage in the presence of blood. Transmission can occur when there is contact between broken skin, wounds, or mucous membranes, and blood or body fluids mixed with the blood of a person who has HIV. So there is no risk of transmission if the skin is not broken. Okay? So, kapag kinagat ka naman ng isang individual na may HIV, pero hindi ka naman nagkasugat, hindi ka may infect. Okay? So, eto, deep open mouth kissing. Ito yung sinasabi ko. Though it's very rare, but there are cases already that has been documented wherein deep open mouth kissing may infect another individual to have HIV, okay, or to be infected with HIV. Transmission can occur if both partners have sores or bleeding gums and blood from the partner with HIV gets into the bloodstream of HIV negative partner. So, take note guys that mucous membranes or the blood must be involved. Okay? So, dapat meron kang open cuts, open wounds. Okay? Aside, of course, from sexual intercourse. Pag mga deep or open mouth kissing. Okay? So, HIV is not transmitted through closed mouth or social kissing with someone who has HIV. Kahit mag-hug kayo, hindi ka may infect ng HIV. Okay? So, even beso-beso or close kiss, of course, the individual will not be infected with HIV. Okay, kahit yung kinabeso-beso niya or yung kinakiss niya is positive for HIV. So, HIV is not transmitted through saliva. Hindi yung saliva, but instead yung sa blood. Okay? Pag mga open wounds, mga ganyan. May mga open wounds, may open cuts, nag-share sila ng blood. Okay? So, female to female. Okay? So, I hope you won't get offended with this one. Pero syempre sa mga lesbian. So, vaginal fluids and menstrual blood may carry the virus, and exposure to these fluids through mucous membranes in the vagina or mouth could potentially lead to HIV infection. Okay? So, pwede din ang female to female sexual intercourse. Pwede din na magkaroon ng infection, okay, ng HIV. Tattoos and body piercing, mga tattoo, okay, hindi tattoos. Okay, mga tattoo and body piercings, if the equipment used for these procedures has someone else's blood or in it, and if the ink is shared, okay. So, in body piercing kasi or tattoo, of course, there will be cuts, diba, to inject the ink, okay, in the tissue level. So, nagkakaroon talaga din ng bleeding. So, what if shared yung needle and even if not the needle but the ink? So, yung ink na share with other individual. So, pwedeng ma-transmit yung HIV from a person who has HIV to another individual who has no HIV if they shared the ink or the needle that was used for body piercing or tattooing. So, this is more likely to happen when the person doing the procedure is unlicensed because of the potential for unsanitary practices such as sharing needles or ink. Okay, that's why if you want to have body piercing or tattoos, please do it with an expert and yung mga license. Hindi kung saan-saang bangketa lang because you are putting yourself at risk to have blood-transmitted diseases. Okay? So if you get a tattoo or a body piercing, be sure that the person doing the procedure is properly licensed and that they use only new or sterilized needles, ink, and other supplies. So we proceed with the myths about transmission of HIV. Hugging and massage. No. You cannot be infected with HIV just by hugging a person with HIV or the person with HIV is giving you a massage. Okay, kasi wala namang body fluid na involved. Masturbation, mag-isa ka lang naman dyan, di ba? Unless, siguro, you let other individual do the masturbation and nagkaroon ng involvement ng oral sex. Pero kung masturbation alone, okay, wala, hindi ka may infect ng HIV. So, dry kissing. So, you cannot get HIV with just dry kissing. Ibig sabihin, no mucus secretion involved. Okay? So, that is closed mouth. Daily living with someone with HIV as long as there is no intimate contact. Okay? So, kung yung kapatid mo, relative mo, kasama mo sa bahay, and he or she is positive for HIV, hindi ka naman may infect ng HIV as long as there's no intimate contact. Pero kung asawa mo yan, of course, you do sexual intercourse, especially if you are husband and wife. Okay, definitely, you'll not use protection. So, yun talaga may infect yung partner. Okay, so we proceed with the symptoms of HIV. So, actually, guys, there are 3 stages, okay, for the development until AIDS, okay, of HIV infection. 3 stages of HIV infection. First is the early stage, also known as the acute HIV infection, followed by the latency stage, chronic HIV infection, and the last one, that is the progression to AIDS. So that is the 3rd stage, having the acquired immunodeficiency syndrome or AIDS. That's why, guys, it's, I don't know if you have noticed that one, HIV/AIDS. Hindi kasi lahat ng may HIV, may AIDS. Okay? Hindi lahat. Hindi ibig sabihin na may HIV ka, may AIDS ka na. No. Okay? Because the AIDS refers to the last stage of HIV infection. Pero lahat ng may AIDS, of course, meron silang HIV. Yung pagkakaiba, when we refer to the HIV, we are referring to the virus causing the infection, human immunodeficiency virus. When we are referring to AIDS, we are referring to the last stage of having HIV infection. Yan na yung 3rd stage. Yun na yung pinakamalalang stage. Okay, so I hope nakukuha nyo yun. Okay, so in the early stage or acute HIV infection, during this period which runs 2 to 4 weeks after the initial infection, some patients experience what they describe as the worst flu ever, also known as the acute retroviral syndrome. Its symptoms include the following: nagkakaroon ng high fever, but take note, hindi lahat. Okay? Some don't display any symptoms during the early stage. Lymphadenopathy syndrome, swollen glands, yung mga lymph nodes. Okay? Paglaki ng lymph nodes, rash, fatigue, and headache. Okay? Although these symptoms do not conclusively mean that a person has HIV. Kasi nga, these are not specific for HIV infection, di ba? It is best to undergo blood screening tests to provide a definitive diagnosis. But during this stage, especially if that is 2 to 4 weeks after infection, hindi kasi ganun kataas yung chance na mag-positive siya. Okay? Because the viral load is still so low. Okay? That may lead to false negative result. Even if you have the virus, but the viral load is so low and that may be detected through the screening process. The latency stage or the chronic HIV infection. During this stage, the virus replicates in the host body slowly. Although this condition is detectable through serologic testing, the patient may experience symptoms of varying degrees. Okay? So, with HIV infection kasi hindi pare-pareho yung nagiging symptom. Okay? So, HIV is still active but reproduces at very low levels. People may not have any symptoms or get sick during this phase. Okay? Pwedeng walang symptoms. Without taking HIV medicine, this period may last a decade or longer. Okay? That's why HIV, okay, a person who has an HIV can live for a long period of time without knowing that they have or they are infected with HIV. Okay? Kasi nga, hindi yung symptoms niya, not specific. Okay? So, parang nagka-flu ka lang. Diba? For the early stage. So, pag nag-develop na yan ng latency stage, wala na masyadong symptoms. Yun na. Parang, ano na lang, you are just doing fine and normal. Okay? Because you are not aware. At the end of this phase, the amount of HIV in the blood, called the viral load, goes up and the CD4 cell count goes down. Okay? Tumataas yung viral load mo during the latency stage, pero bumababa yung CD4. CD4 na T helper cell. The person may have symptoms as the virus levels increase in the body, and the person moves to stage 3. Okay? So, people who take HIV medicine as prescribed in the HIV treatment program may not lead to the stage 3. Okay, stage 3, last stage na kasi yung pagkakaroon ng AIDS. Okay? So, AIDS is considered the final stage of a person infected with HIV. It is characterized by weakening of a person's immune response due to a decrease of CD4 cells in the body. Kaya nga siya acquired immunodeficiency. Okay, mababa yung immune system. Okay, immunodeficiency in the immune. Okay, in immune response. One or a combination of the following symptoms may manifest in a person with AIDS. Nagkakaroon na ng rapid weight loss. Mabilis ang pagbagsak ng weight. Okay, recurring fever or profuse night sweats, extreme and unexplained tiredness, diarrhea lasting for a month, pneumonia, memory loss, depression, and other neurologic disorders, sores in the mouth, anus, or genitals. Okay? So, this one, dito na magtataka yung isang individual because of the so many symptoms that are appearing. Okay? However, at this stage, medyo late na. Why? Because you are prone to many infection like TB, pneumonia, okay? So, bakit nagkakaroon ng prone to infection yung mga taong may AIDS? Because of their very low immune response. Mababa na yung pag-respond ng kanilang immune system. That's why it's easier for bacteria and other microorganisms to attack their immune system. Mas madali na silang ma-infect as compared to healthy individuals. Okay? Kasi sobrang baba na nga ng CD4 count nila. Okay, so that's all for the first part. For the second part of the recorded discussion, okay, we will be having a discussion about AIDS Council and Agency. So, si PNAC as well as the provisions of the HIV law. So, thank you for listening. Please listen again to the part 2 of this discussion. Thank you.